Now this is quite a complicated subject because actually there's several types of gastric bypass and it can be very confusing from patients when they come along to discuss gastric bypass. It's not in Australia the most common surgical procedure. It's sometimes done as a revisional procedure. It's sometimes done for patients with significant reflux. But the essence of the operation in gastric bypass is we're actually effectively excluding a segment of your small bowel. Gastric bypass is also a keyhole procedure. It generally takes a few hours to perform. And all the procedures are essentially the same thing. Imagine if you had 6 meters of small bowel. In this procedure of gastric bypass, we're effectively removing about 2 meters, sometimes a bit less, but round about a third of the small bowel is excluded or sort of pushed off to the side. There's various ways of achieving that, but it does mean that when you eat, food goes through 4 meters of bowel rather than 6 meters of bowel. It's essentially a redundant part that's pushed off to the side, and so you have a smaller area to absorb food, and that's why patients lose weight. So it's different to procedures like gastric banding and sleeve gastrectomy, which are restrictive procedures. In those procedures, the stomach's made smaller, basically. In gastric bypass, usually there is a component of the stomach being made smaller, but essentially the food goes through a slightly shorter bowel, and there's less chance to absorb food and nutrients, and the end result is pretty good weight loss. And gastric bypass is really good for weight loss. It's generally a bit better than sleeve gastrectomy. Sometimes the weight loss is a bit more prolonged, over about 1.5 years rather than a year. And it's also very good for resolving issues such as type 2 diabetes in particular. So there are some advantages and there are some disadvantages for gastric bypass. And it's quite a complicated subject, and it's going to be really important that we sit down and have a discussion about what's best for you as a patient. And we can go all through that, and we can draw some diagrams and make it a bit easier for you. And there's some information on our website also which should be of help to you. Thanks again.